Good afternoon and welcome to the Facebook Live session from MGM Healthcare. In view of the Sexual and Reproductive Health Awareness Day that is today, we are going to have an interactive talk show from Varam, the dedicated Women's Super Specialty Center, on common sexual health issues and its treatments. On the panel today, we have with us Dr. Arcot Jaishree Gajaraj, the Senior Consultant, Obstetrics and Gynaecology, and Niveditha Bharathy, the Senior Consultant from the Department of Varam. So, Dr. Niveditha will join us in a while. But before that, ma'am, welcome to the talk show today. And we're very happy that you are there with us this afternoon. So, on the in the outline, so we would like to know exactly what is sexual health all about and why is it gaining importance to talk about it now?
Actually, it's a very relevant topic to be, to think about and to act about, because when you mention the word sex, see, it seems to have a very wrong connotation. People immediately think of all the wrong things about it. But the word sexual carries a much broader meaning. And that is what we are looking at when we talk of sexual health. So sexual health will encompass not only the physical health of the woman, the mental health, her day-to-day well-being. A lot revolves around this one word, sexual health. So, as we go along, we can touch on different aspects of this. But basically, it is what is it. It is not just the very physical act of a woman having a sexual intercourse. There's much more. It is sexual well-being and sexual health.
So, what comprises of sexual health, ma'am? I'm sure you started off by saying there is a lot of connotations towards the word sex. But what exactly is sexual health and why is it important for a woman to be aware of that?
See, now, time immemorial, I think we've always thought of, okay, a man and woman get married. Having sexual contact is one of the necessities or one of the essentials of a bond called the marriage. And we know that such a bond also takes place outside of marriage. So what are the implications of this? It's not just that one physical act alone. What is the woman's attitude towards this? What is the man's attitude? What is the couple's attitude towards this? Now, if there is no sexual contact between a man and his wife or a man and a woman, what are the implications? Can there be negative implications if we don't have sexual contact? So it actually forms a part of day-to-day life in a couple. Unmarried or married is a different issue. We will not debate that here. Now, when we talk of it from the woman's side, if she is unmarried or she's married, she may have some fears about sexual contact itself. Now, would she have any fear about getting sexually transmitted infections? Will she be able to perform at all? Will she be able to have proper intercourse when she has it with her partner the very first time? Will there be pain? Now, will she land up with a pregnancy for which she is not ready yet? So there are many aspects. And also in the long run, if a woman has had 2 or 3 children and her pelvic floor becomes weak, then she starts wondering, will I be capable of having a proper sexual contact, of having an orgasm? Will I be able to fulfill my own needs and my partner's needs? So these are many that go through women's mind. And depending what age she belongs to and what stage of her life, different fears come to the forefront, as it were.
So, what is then sexual dysfunction?
Sexual dysfunction, one could say, is simply the lack of all that I have said just now. But again, I think it is much more than that. So, when a woman is unable to have sex for whatever reason, then for her, it is something, probably a pleasure that has been denied, probably something that she has wanted to have but has never achieved because of social reasons, because of cultural reasons. A woman who may not have got married for a very long time may have this kind of curiosity about what is sexual activity, what is sexual health. A teenager who is not yet ready for the implications of sexual activity may actually go into it. So again, what is the negative aspect of sexual health to some extent may form sexual dysfunction.
So, do you feel that women in our country specifically, go through sexual dysfunction?
Most certainly, yes. But as I told you earlier, the word is taboo. Nobody wants to talk about it. Nobody wants to discuss it. But it is very much there, whether it's a woman belonging to the metropolitan area or whether it's a woman who belongs to the rural area. It's definitely there. A woman is a woman wherever she is. Her needs and her wants are the same. But it's just the way that it is addressed, the way that it is put forth on the media is so different. So women who live in cities have access to a lot of information either through the net, whether it's through the television, through media, they have a lot of information. But women who are in the rural areas, it's purely what they hear from their elders, from their mothers, grandmothers, or their aunts. And to some extent, that will be a directed kind of information because culturally, a girl is born, she attains menarche, she gets married, she has children, she undergoes menopause, she becomes a grandmother. That is the traditional role. But definitely, whether it's a working woman or a woman working on the fields, she does have a sexual need. And this sexual need is addressed in different ways. So, yes, certainly it is very much there in our country and something that as healthcare workers, I always feel that we need to talk about it.
That's very true, ma'am. I think it's one topic which I'm sure at any level, it's probably the most less spoken topic among
Definitely.
even among friend circles, social circles, and more so in a professional group. So, is there any single important cause, ma'am, for sexual dysfunction?
I don't think there can ever be a single important cause. I think it is multifactorial. There are many, many reasons why this woman has this negative attitude towards it. And as I mentioned earlier, some of these are the fear of a pregnancy, which she may not be ready for. The fear of maybe she has not given a commitment to that particular partnership. Maybe she's scared, she's afraid of having been during intercourse. Um, she is, there's always this fear of having sexually transmitted infections, which is a reality. So all this will contribute to it. So it's not a single factor.
So, yes, even though we know that it is a very less spoken topic, so have you seen from your practice women coming forward to discuss this to a medical person, as to a doctor?
See, it's strange that you ask me this because even amongst our own fraternity, that is doctors, gynecologists, whenever we have brought up this idea of discussing sexual health rather than sexual dysfunction, I am very involved in the menopause society. And as we grow older, these women actually are worried about their sexual well being. And whenever we have wanted to discuss this in any forum, there are at least 50% of our own colleagues who say, why should we discuss this in public? So, unless we are going to discuss it and sort out for ourselves how to present it to the public, it's going to be very difficult. Now, in a clinic, sometimes, like for example, a woman comes with what we call descent of the uterus, that is a prolapse of the uterus. And this it's there, it's definitely there, and they are quite happy to discuss it. And once we give them the solution, there's a totally different change in their attitude. They're ever so thankful.
That's basically knowledge is power. Until they knew what is actually
Yes.
going to happen, the repercussions, I think once they know that it is sexually transmitted infections, ma'am. So I would like to explain more on that, ma'am.
See, sexually transmitted infections are definitely still there. We have not been able to get rid of it. And however much we may scream from the rooftops about contraception, barrier contraception, etc., it is still not being used by most couples. So the chance of a sexually transmitted infection is definitely there in any relationship. Now, we find this more often in teenagers, who are yet unprepared, who have multiple partners. Here, the incidence of STI is much, much more. Now, within a marriage, also there can be fear of sexually transmitted infections. Sometimes we get patients who come to us and say, "I have a doubt, ma'am. So can you do something? Can you do some tests to rule out?" Now, there are limitations to these tests. So there are some tests that we can run, and at that moment in time, we can assure her that she doesn't have. But nothing prevents an infection from developing a couple of weeks later, few months later. So that fear is always there, and unfortunately, we are able to reassure them only up to a point.
Also, on the other fear for most of them is the unintended pregnancies. So, what is the load presently, ma'am? If you could just throw some light on numbers in terms of what is the actual load of unintended pregnancy that we are actually seeing these days.
Okay, if I could just add one line about the sexually transmitted infection before we move on, I'm sorry about that. Now, we have this particular infection called herpes, right? Many women will suddenly come up with multiple ulcers, and we know it is herpes. So we have to tell them it's a virus infection. How did I get it, doctor? Maybe sexually transmitted. And then immediately the alarm bells go off. They are wondering where the husband has gone, what has happened. So we are in a very delicate situation. So we try to kind of play it a little low, tell them that, we'll discuss this later. First, let's get rid of the infection and then try to bring the partner in. So we are faced with this quite often, and it's not uncommon at all, irrespective of the socio-economic status, to get this, these kind of infections. So talking of unintended pregnancies, the word unintended itself, I think, speaks for itself. So the woman or the couple did not intend to have a pregnancy at that time. But who does it affect? It affects a woman more than anyone else. So the male partner doesn't really affect him as much as it affects a woman. So the WHO actually come out with statistics for almost 74 million unintended pregnancies per year in the lower and middle income group countries. So that is a huge burden. And it doesn't stop with that. What happens when a woman has an unintended pregnancy? She tries to go for an abortion. Now, because of social taboo, cultural taboo, she sometimes has to go for the untraditional or the unconventional methods of going for an abortion. This is invariably an unsafe abortion. So we are talking of almost 25 million unsafe abortions per year. And an unsafe abortion can land up with a lot of complications for the mother, which we call morbidity, through which she lives. But we can also lose a mother, unfortunately, due to unsafe abortions. And the number is almost 47,000 maternal deaths per year because of unsafe abortions. So, starting with an unintended pregnancies, we are going all the way to losing a mother for a reason which can easily be avoided.
Does it affect across all age groups, or is it very specific? Do you see it as a trend through a particular age group? This is where we see a lot of unintended pregnancies, or do
Yeah.
you see it as a pattern across all fertile age group?
No, we see it more in the younger age group, the teenagers, and then we see it at the other extreme of life, that is the early 40s or into their 40s. Because teenage pregnancies mostly it's out of a marriage, out of a partnership. So once the parents come to know, or sometimes at least if the parents come to know, they take them for safe abortion. But when they try to do something without their parents' knowledge, that is when they land up in a place where they shouldn't be, where they go in for unsafe abortions. Now, the other extreme of life, for example, the 40s, when I say life, I mean reproductive life. Here again, there's a lot of embarrassment for the couple at this time, but it's very embarrassing for them to go to a doctor because that doctor may be the family doctor for about 10 families within their family. So, will others come to know I'm 45 and I'm pregnant? Oh my God, people will think I'm still sexually active. No, that is wrong. So, these are the things that go through their mind. So, out of sheer embarrassment, they go for unsafe abortions. So, we see it more at these two extremes. But in the 20s, 30s, they're quite happy to come forward to a doctor and take advice.
So when they are going in for unsafe methods, what are the? I would like you to explain, ma'am, because I'm sure it is going to help our viewers more. Because what are the possible complications a woman will face if she goes in for an unsafe practice of abortion?
See, the methods used are unsafe. Now, most of the time, it is actually um, some plant sources that are used. Sometimes medication, which is a mixture of a whole lot of unknown substances put together. So basically, the principle behind it is that if any foreign body is introduced, the uterus will start contracting. So what happens in these unsafe abortions? They either use the twig of a plant, or sometimes they combine medical methods along with their own methods, the unsafe methods. So you get two types of uh, methods that are used to cause the abortion. So the potency is much more, and therefore the complication rate is more. We can actually go for very gross infection. They have severe bleeding. So sepsis is very common, and sometimes they can actually perforate or make a hole in the uterus, and this lands up with any number of innumerable complications. And that is when we lose the mother, because there is always a delay in such girls or women coming forward and coming to a hospital for help. So the delay also contributes to the maternal death.
So yes, so these are mostly like we were talking about post an incident, like unintended pregnancies. How are we going to stop? How can we actually prevent an unintended pregnancy, ma'am? I'm sure that is another pressing topic, on sexual health. That is another important thing that I'm sure the viewers would like to know. How to prevent an unintended pregnancy?
Certainly, I think that should be our entire focus should be only on that.
Yes.
That is the only way we can actually prevent unintended pregnancies and the consequences of unintended pregnancies. So that is called contraception. That is, we are trying to prevent a conception. So when we say contraception, we are trying to allow normal sexual activity in a couple, at the same time give them the means to prevent a pregnancy. So there are a number of methods that are available, and you can either go for the birth control pill, you can use the barrier method like the condom. The female condom is also available, and we have other methods like the vaginal sponge, etc. For women who have had one pregnancy, we usually advise them to go in for the intrauterine contraceptive device. So these are the methods that are widely available, but a particular available method may be more suitable for a particular woman at that particular age. Now, when it's a young girl, we usually advise either barrier contraception, or we ask them to go on the pill, because when we use a barrier contraception, we are also obviating this problem of sexually transmitted infections. Now, the pill is very safe, but a teenager who is sexually active, multiple partners, may benefit from prevention of pregnancy, but she may not take it regularly, and that itself will expose her to more unwanted pregnancies. The long-term effects of taking hormonal contraception again starts coming in once they use it for more than 10 years. So, there are downsides to everything, but the bottom line is that we should actually take every effort possible as healthcare workers, healthcare professionals, to create awareness. So once awareness is created, they will come forward to us. And when they come to us, we can then talk to them and advise them, see what their situation is, and then give them the ideal method that they can actually use.
Right, ma'am. So we have a question from one of our viewers. Is there any treatment for ED, erectile dysfunction?
Yeah, I think we were probably going to touch on this a little later on. Yes, erectile dysfunction, we first have to, the beginning of the treatment for that is coming forward for treatment. Now, we get couples who have not conceived for a long time. We have given them any amount of treatment, we have done all the investigations. And then on one occasion, when the woman is sitting with us alone in the consulting room, she said, "Doctor, my husband has a problem. I think he has erectile dysfunction." So that is when we start questioning, we start asking, and at that time, they actually come forward and say they've had this problem all along. We then refer them to an andrologist. So andrologists actually go into the detail of why this woman has an erectile dysfunction, why this man has an erectile dysfunction. Is there any background reason for it? Has he had any previous experience which has led to this, or has it always been there? So there are multiple issues. a combination of counseling, psychological, advice, and then there are some medications for it as well. It can definitely be taken care of.
So when we talk about sexual health, ma'am, so uh, does it always benefit that we do a counseling for the couple together? Will it help, or is it important that we speak to them in isolation? What is it from your experience?
It depends primarily on who has come to you first. If the woman has come to you alone, and for some reason she wants it to be addressed only to her, then I think we should be talking only to her. If they come to you as a couple, then as a couple we need to talk to them. So it basically depends on what they want. See, it's an individual right. It could be a man who comes alone also. So we have to respect what they want and go accordingly. We cannot insist and say, bring your partner along, we have to talk. We may at some point, but we have to offer help even if they come individually.
So also while we're talking about sexual health and sexual dysfunction, is there an effect of or domestic violence leading to sexual dysfunction or vice versa? Your thoughts on that?
Both ways, I think, because again, like just as we were discussing about sexual dysfunction, existing but not existing, domestic violence also exists, but then everybody prevents it does not exist. So it's you know cause and effect both, because sometimes domestic violence itself may lead to sexual dysfunction. The woman or either partner would be afraid to enter into a sexual act because of fear of any violence later or before or during. Now, sometimes the fact that the woman or the man may not comply when the other partner wants to have sex can also lead to domestic violence. So either way, I mean, domestic violence doesn't necessarily mean the man alone is hating the woman. It could be both ways. So definitely, both are very much interrelated, is what I would say.
Is sexual violence also a kind of domestic violence?
Certainly, certainly, there's no doubt about it. And if domestic violence is going to be swept under the carpet, sexual violence, much more. People would never come forward with it. But we actually see them maybe sometimes in the emergency when they come to us with bleeding or with tears. That is the time when we see this.
So while we're talking about sexual health, it's more of directly you can link it to empowering women. Women empowerment for them to even understand what is their rights on their body.
Yeah.
So I would like you to explain, ma'am, what do you think is a woman's right on understanding this concept of sexual health? How much do you think that it's not known to them?
Well, it's a birthright to begin with. I mean, a woman has to know. She's born a woman. She needs to know what her rights are, and definitely her entitlement as a woman. As she grows up physically, then when she becomes attractive to the opposite sex, what is expected of her, how she can take care of herself is very important. When she enters a marriage again, what is expected of her from the physical and the emotional side of it. We need to again empower her before she goes into a marriage. As she grows older, what are the problems of actually having sexual intercourse? What about the pain? Can somebody help her? She needs to know about it. So we do have a lot of programs focused on different age groups where we keep talking to them. All through we talk about contraception as well. But how much of it actually reaches, how much of it is actually digested and accepted is something I think we really don't know. But I don't think we should stop. We should just keep on doing it.
So, as we are kind of coming to an end of our session, ma'am, I would like you to say a few words in terms of what a woman should know. Probably some quick tips for women to ensure that they are healthy from the sexual life.
Primarily, as we said, equipped with the knowledge that is required. That's very, very important. And I would say some of the knowledge can be taken off the net, but some of it is better discussed either with an elder relative in the house or with a family doctor or with a gynecologist, somebody whom they trust. So they need to combine both and take what is best for them. As they go along, education, work, they again need to be very aware of what is happening, what can happen is what they need to be aware of. That only then can they prevent. How the government or the family actually help them, give them the support to protect themselves is also very important. We are repeatedly hearing of sexual abuse against women, but the government is constantly trying to help these women by giving them apps that they can use. But the woman should be told that she should go forward for help. She should approach the authorities. Only then can some kind of justice be given to her. Whether, as I said, it's within a marriage, outside a marriage, when she wants help, that woman should know and have the confidence that if she goes to an authority, she will get what is required. So that kind of empowerment is what we should give our women.
So we've been talking about women and sexual health. Something for men, sexual health for men.
Okay, I think you're probably asking the wrong person. I'm a gynecologist, but yes, they form part of, they are my patients' partners. So I guess I can't completely say I don't know enough about them. But see, their needs are probably slightly different. Now, if you take a teenage boy, this teenage boy starts developing this feeling that, yes, it's his, he can do what he wants. So somebody at that point needs to temper his thought process, needs to tell him that, this is what is expected of you, this is what society expects, this is how you should be. And then once he goes into a marriage also, we find that, most of the time, the men or the boys are told by even their own elders in the house that you are supreme, you have to have that supreme over your partner, don't ever give in. So these sort of things, I feel we should talk to them even earlier and tell them about it. A man is, because of all this different types of empowerment for men, when they actually have a problem, they hesitate to come forward for help. A woman may actually come forward and talk to her doctor, whereas a man very, very rarely comes forward himself. So that is something we need to address. We need to be aware of that, and we need to give them the encouragement that there is help. Now they feel that society or other people may make fun of them if they come forward. We was recently discussing about ED, erectile dysfunction. Now a man would never own up to this, so it's unfortunate. But we need to tell him that there's nothing. You come forward, we will help you. You can lead a normal life. I have at least two couples with me who, after nearly 15 years of marriage, were able to consummate their marriage. But what helped was the perfect understanding between the two of them. 15 years, the marriage survived. And, the happiness that they felt and gratitude, if I may say so, was something I even remember even today.
So thank you so much, ma'am. Thank you for spending your time and patiently answering all our queries and the queries that we had from our viewers as well.
Sure.
So I'm sure our viewers would have benefited from this talk, and I think it's more of I think it's time to speak up and speak out and get to know what you need, but from the right sources.
Yeah.
And talking to an expert always matters, and more so if it is with our doctors. So thank you, viewers, for spending your time and watching the talk show with us. Stay tuned. I'm sure we will be getting back to you with many more such interesting topics in the future. And if you have any queries, feel free to post your questions on the comment section. Our doctors and our expert panelists would be more than happy to answer your queries. Thank you all so much and have a great day. Thank you, ma'am.
Thank you. Thank you very much, Hazel, for coordinating the whole thing. And thank you, viewers. I hope you benefited. Thank you.